Okay, let's jump right into a topic that is absolutely critical for anyone with a newborn: medication safety. We're going to break down the biggest risks and, more importantly, the simple rules you need to know to keep your baby safe. Let's do this. First things first, we need to be crystal clear about the stakes here. A newborn's body is it's incredibly fragile. They have what doctors call very limited physiologic reserves, which is really just a fancy way of saying they don't have a backup plan. They can't handle mistakes the way an adult or even an older child can. So what might be a tiny error for someone else can be a huge life-altering event for a newborn. And we're not talking about a little upset stomach or a minor issue. This can become a true life-threatening emergency. The main danger we're focused on is how certain medications, when overdosed, can cause a newborn's heart rate to slow down dramatically. And that condition has a specific name. It's called bradycardia. And let's be clear, this isn't just a slightly slow pulse, this is a dangerously slow heart rate. One so slow that it starts to starve the body, and crucially, the brain of the oxygen they desperately need to function. So the big question is, how does an overdose actually make this happen? Well, it's not a mystery, and it's definitely not random. It's a direct biological chain reaction. Let's walk through exactly what's going on inside that tiny body, step by step. To get this, you have to understand that a lot of medications are designed as depressants. Their whole job is to slow things down. They act on the body's main operating systems: the central nervous system, that's the body's command center, the respiratory drive, which is the signal that tells us to breathe, and the autonomic nervous system, which handles all the automatic stuff, like our heart rate. It really happens just like a set of dominoes falling. First, the overdose occurs. That medication then hits the brain and suppresses the drive to breathe. So breathing slows way down, or it might even stop completely. The second that happens, oxygen levels in the blood just plummet. Now here's the key. A newborn's heart rate is directly linked to their oxygen level. So when the oxygen drops, the heart rate follows it right down. And that's exactly how we get to bradycardia. Now, while a few different kinds of medications can cause this chain reaction, there's one class of drugs that's a huge concern, and we need to put a spotlight on it, and that's opioids. It is so important to understand why these in particular are so dangerous for infants. So, why is a newborn so incredibly vulnerable? It really boils down to two things. First, their metabolism is brand new, it's still developing, which means they can't break down and clear drugs out of their system very well. And second, you just have to think about their tiny body mass. A minuscule amount of a powerful drug, an amount that would be small for an adult, becomes a massive dose relative to their little size. So what does this actually look like? What are the signs? Well, the symptoms are really severe. You'd see that bradycardia, the slow heart rate. You'd see what's called profound respiratory depression, which just means their breathing is dangerously slow and shallow. You might also notice hypotonia. That means poor muscle tone. The baby might seem really floppy, almost like a rag doll. And of course, they might not be feeding well and seem extremely tired or lethargic, maybe even hard to wake up. Okay, so we understand the danger. Now let's switch gears to the single most important part of this whole conversation: prevention. These are the simple, powerful rules that can stop a tragedy before it even has a chance to start. You know, these steps aren't complicated, but you have to be disciplined about them. First, all medications, and I mean all of them, not just prescriptions, they have to be locked up and completely out of reach. Second, with any liquid medicine, you have to double-check the concentration on the bottle. Different formulas can have different strengths, and that's a huge deal. And finally, you follow the guidance from your doctor or pharmacist to the absolute letter. No exceptions. And this point right here, I cannot overstate this. Accuracy is everything. You must use the specific dosing syringe or the dropper that came with the medication. Never, ever grab a household spoon. A teaspoon from your kitchen drawer is not a standardized medical device. It's a really easy way to accidentally give a significant overdose. All right, so prevention is key. We've got that. But you also need to be ready to act if something seems wrong. Let's go over the absolute critical warning signs that mean you need to get immediate medical help. These 3 signs right here are your red alerts. If a newborn has slow or very shallow breathing, if they seem limp and have that poor muscle tone we talked about, or if they're less responsive than usual or they're hard to wake up, you have to treat that as an emergency. You do not wait, you act. So let's just summarize the main medical takeaway. Here it is. A medication overdose in a newborn, especially when it involves opioids, can directly cause that dangerous slow heart rate and can stop their breathing. This is never,
ever something that just gets better on its own. It always requires immediate medical help. And we'll end on this simple but really critical question. Do you know who to call in an emergency? And I mean beyond your local emergency number. Is the number for poison control saved in your phone right now? If you have a babysitter, is your address posted clearly for them? Thinking through these small details now can save precious seconds when it matters most. Thanks for joining us for this explainer.